Wile disease. According to Ruth Morgan and Mike Cadogan, in a so-named article within the publication Life in the Fast Lane, published December 26th of 2020, is a severe icteric form of a bacterial infection caused by the pathogenic spirochete leptospirosis, with stereotypes including leptospirosis icterohemogorica, leptospirosis interrogans, leptospirosis pomina, leptospirosis canicola, and leptospirosis autumnalis. This dangerous pathogen does not take well to gram staining, as spirochetes often don't. Therefore, other forms of microscopy staining, including dark field, fluorescent, or silver stain, is often utilized while observing this dangerous pathogen. Discovered in 1855 by a man named Adolf Weil, leptospirosis is a waterborne zoonotic pathogen, most distinguished at its time and currently by its causation of jaundice, splenomegaly, which is spleen inflammation, and nephritis, inflammation of the kidneys. Commonly found around the world in tropical humid climates due to the contaminated water sources, allowing free rein to grow and populate as they so please. This bacteria can also be transferred through livestock vectors into highly populated areas such as Argentina, Brazil, India, and regions within Africa. Small mammals such as rodents, house cats, foxes, and other wild mammals often come in contact with contaminated water sources and become host to this dangerous pathogen, where they then can transmit by urine into contaminating soils and other water sources, as well as food sources, which can later infect small pets such as dogs, large livestock such as cattle, horses, sheep, and goats, as well as humans who may have an open wound that could come in contact with the soil as they are doing their gardening. High-risk factors include hunting, fishing, gutting, butchering, clamming, swimming, boating, planting, and weeding, as well as anything else that could possibly bring your mucous membranes or open wounds into contact with contaminated soils or water sources. During its incubation phase, the spirochete enters the body through ingestion or previously mentioned fluid contact, which then burrows deep amongst the tissue into the apical surfaces of the cuboidal cells of the kidney, as well as other organs, and hides itself, shielding itself from the host's humoral immune system. During its septicemitic phase, symptoms develop such as sudden onset headaches, muscle pains, and nausea. Once entering its interphase, advanced symptoms such as the redness in the eyes associated with jaundice, as well as fever, may temporarily subside as the body begins to expel itself from the body in order to further transmit to other hosts. Recurring fever during the immune phase, as well as meningitis, may develop due to the bacteria continuing to reside in the host long after symptoms have been completely resolved. It can then be transferred again and again through urine into clean water sources. Common symptoms of early to mid-range detection include fever, chills, headache, vomiting, loss of appetite, muscle pain, and redness of eyes, as well as a cough as the body desperately attempts to dispel this pathogen from within itself. MAT testing, also known as microscopic agglutination testing, is often the gold standard for detection of this spirochete, though ELISA and PCR, polymerase chain reaction, are regularly utilized in detecting and treatment monitoring of leptospirosis. When detected early, amoxicillin, ampicillin, and doxycycline are typically utilized, though, due to many individuals' allergies, other antibiotics such as quinolone, cefotaxime, or ceftriaxone can also be used. Severe cases may be necessary to have a penicillin drip directly into the bloodstream, while ventilators regulate bodily processes such as breathing, and dialysis filter through bodily fluids in order to dispel many of these dangerous spirochetes from the body. Protective measures include using clean water for not only hygiene but consumption, proper wound cleaning using this clean water, as well as waterproof bandaging, avoidance of dead animals whenever possible, and utilizing the proper personal protective equipment when necessary to do so. General PPE, while amongst soil that could potentially be contaminated, such as galoshes or waterproof gloves, could be also used. Vaccinations of livestock and pets is also heavily recommended, though to my knowledge is not readily available for human use. In summation, leptospirosis is a waterborne zoonotic pathogen, which is most prevalent in humid tropical climates. The spirochete is often detectable through microscopic agglutination testing and does not take well 2-gram staining. It enters the body through mucous membranes and direct fluid contact, where its spirochete nature flagellation drives bacteria deep into tissues and organs, where it can cause massive organ failures and several sicknesses, including jaundice. It may remain in the system long after symptoms have subsided entirely.